want to be close to you. I'll take you anywhere, even if you break my heart today. Should you become my own?
Welcome back, genius. I'm GDY who wants to English fluently like native speaker. You better turn on the subtitles. The muscle we will study today has severe effects on your pelvis and hip joint alignment and dysfunctional pain. Today's main character is the Pectineus muscle. First, let's draw. Take a picture of your pelvic side. Draw the size of the pelvis and femur on the picture. The Pectineus starts from the inferior ramus of the pubis. Also, it attaches to the pectineal line and medial lip of linea aspera, which inside and a little bit posterior part of the femur. Let's draw one more picture of the front. Take a picture of yourself in the front of your pelvis too. Then draw the pelvis and femur. Then draw the Pectineus. Let's look at the Pectineus muscle from the front and think about it. The Pectineus starts from inside of the femur to the pelvis. Moreover, it goes to inward. It attaches to the inferior ramus of the pubis. It's the lower frontal part of the pelvis. When the pelvis fixed, the Pectineus shortened and concentric contracted, it can pull the femur inwards. Moving inwards of the femur means adduction of the hip joint. Imagine that your client hip joint is more adducted than neutral alignment. Will his Pectineus be shortened or longer than normal length? Of course, it's shortened. So should we stretch his Pectineus or more shorten them? You're not trying to be shorter, aren't you? On contrary, your client hip joint is more abducted than neutral alignment. His Pectineus muscle length is longer than normal length. In this case, you should exercise his muscle to shorten so that the length of Pectineus muscle can be restored to its normal length. Next, lateral view. If the pelvis is fixed, the Pectineus is shortening and concentric contraction. The femur can be pulled forward or backward. The Pectineus muscle is headed up forward. As you can see, if the muscle gets shorter, it pulls your femur going backwards. That's ridiculous. Your femur must move forward. Moving the femur forward means flexion of the hip joint. His Pectineus muscle is shorter than normal length. That makes sense? On the contrary, your client hip joint is more extended backward than neutral alignment. His Pectineus muscle length is longer than normal length. We already know how to correct it. We stretch it when it has shortened. We have made it shorten when it has stretched it. What do you think? Musculoskeletal alignment correction is pretty easy, aren't you? Maybe it's because I explained it to you easily to understand. Okay, sorry. Now, inside view. If the pelvis is fixed and the Pectineus is shortened and concentric contraction, the femur can be rotation. The Pectineus is attached to the inside and posterior part of the femur. When the Pectineus is shortening and concentric contraction, the femur can be external rotation. If your client's hip joint is more external rotation than neutral alignment, his Pectineus muscle length is shorter than normal length. If his hip joint is more internal rotation than neutral alignment, his Pectineus muscle length is longer than normal length. Just a sec, let's think again about what we have been talking about. Adduction of the hip joint, flexion of the hip joint, external rotation of the hip joint. I remember seeing such a person somewhere. That's me! Also, it is someone who is doing the same posture as me and watched this video, like you. I flexed forward my right side, adduction, external rotation. So I've made my right Pectineus muscle shorter.
Oh no!
Yes, triple combo. Let's change the role. The Pectineus also affects to the pelvic alignment and movement when the femur is fixed. Now your femur is fixed and your Pectineus concentric contraction. The pelvis will move towards the femur. The Pectineus goes downward and backward. It makes anterior tilt of the pelvis. If your client's pelvis is tilted forward rather than neutral alignment, his Pectineus length is shorter than normal length. If your client's pelvis is tilted backward, his Pectineus length is longer than normal length.
lost without you.
Wow, your right pectineus muscle was more shorter.
I know it's true. I get lost, I get lost, I get lost.
And can review one more time. When the femur is fixed, the pectineus pulls the pelvis toward the femur. If the right pectineus pulls the right pelvis, the pelvis moves to the right side. And at the same time, it also elevation. So your right pectineus can elevation of your right pelvis.
I'll take you anywhere.
Wait. I couldn't make sense. The pectineus goes down to the femur from the pelvis. If it pulls the pelvis down, isn't it lowering the height of the pelvis? Yes, that's right. If the pelvis and femur are separate from each other, the pectineus will pull the pelvis down. However, thinking about carefully, a hip joint connects the pelvis and femur. Moreover, your right pelvis is connected to your left pelvis and also the sacrum. So you're standing on the ground with your both legs. Your legs are fixed. When the pectineus pulls in the lower medial part of the pelvis, the central part of your pelvis is lowered, but the lateral part is raised. In other words, the pelvis tilts to the other side. So if the right pectineus get a shoulder and concentric contraction, the lateral part of the right pelvis will raise. Your pelvis tilt to the left. Both mean the same thing. Yes, more.
The moment I turned and saw you was the moment I said I'm sorry.
Let's summarize today's study. Body types in which the pectineus muscle will be shorter than the normal length. First, a body type in which the hip joint is adducted and neutral alignment. Second, a body type in which the hip joint is flexed forward rather than neutral alignment. Third, a body type in which the hip joint is rotated outward rather than neutral alignment. Fourth, a body type in which the pelvis is tilted forward rather than neutral alignment. Fifth, a body type in which the pelvis has deviated the lateral side and elevated rather than the other side. Shortened pectineus muscle has a super influence on the joint strain reaction of the lower body mobility side. Next, body types in which the pectineus muscle will be longer than the normal length. First, a body type in which the hip joint is abducted outward rather than the neutral alignment. Second, a body type in which the hip joint is more extended backward rather than the neutral alignment. Third, a body type in which the hip joint is rotated internal rather than the neutral alignment. Fourth, a body type in which the pelvis is tilted backward rather than neutral alignment. And fifth, a body type in which the pelvis has deviated the other side, and also the pelvis height is depressed than the other side. Do not just sit there and watch. Do it. Move. Action. You can do it. First, you take a picture of your pelvis area. Second, draw the pectineus muscle. So you think about it, my pectineus muscle length is normal or abnormal. You can tear it up.
I know it's true. I get lost, I get lost, I get lost without you.
The pectineus muscle. You wanna see more picture? Check in my Instagram. I hope today's video will help you to be a genius of body type. See you soon, guys. Genius.